Hello, this is Dr. Ben Rader and Dr. Mike Zussman. We're with the public education campaign through the Wisconsin Psychological Association, and we're connecting today on managing risks while out in the community and working with clients amidst the COVID-19 coronavirus. Hey, Mike, how's it going?
Good, Ben. How are you?
Good. I'm all right.
Good. Yeah, this is such a unique and different thing for me to be able to
do this whole video conferencing thing.
Yeah, I know.
But I guess it's what we have to do right now, and it's out of our control. And in fact, with my clients this past week, I have decided for the whole week just to do straight telehealth, and I haven't seen a client face to face since the Friday before.
So it's been hard because that face-to-face time is important. But I understand you have seen some clients face-to-face, so I was wondering how that's been going for you.
Yeah, I'm glad you're asking and kind of checking in on that. And my perspective right now is similar to yours, is that this is a pandemic. This is something that we can't control. And the best course of action is really to get on and to communicate formats like this. An example of kind of how largely my practice has been impacted is that I work in nursing facilities. Some of the work that I do is in assisted living facilities, and in those places, they were the first to shut their doors. I can't get in there. Some of my clients, though, surprisingly, even elderly persons 90 years old and over, as I've reached out to them, they've Skyped before. They have it set up to talk to their grandkids,
right? Yeah,
and they're used to this idea of face to face over the computer. So some of them I have been able to keep in contact with, and still see them in a format like this, which has really been great. Unfortunately,
that's great, because I would think that a lot of them right now really need this, because that's all we keep hearing about is the risk of the elderly. So their anxiety must just be
really high. Yeah, that's right. My practice serves a lot of at risk, and some of the clients I have don't have access to the internet, or right now they're not comfortable connecting in that format because they haven't had they almost need somebody to walk them through it or something, which kind of means you're doing telephone sessions or talking to people on the phone, which is good, but it's a little different than face to face. I have had a smattering of clients that I've continued to see in my practice, and I've got a couple that I've seen also in the community that were higher need that I needed to check in on, as some of the work in my job as a community psychologist has me in people's homes. And fortunately, the entities I've been serving have kind of given us some screening questions that we're using, and that kind of gives me some better assurance that before I actually see somebody in person, we'll ask some questions in the format of a screener to see if we can even meet with each other.
What are those? Because I haven't had to ask any of those.
Sure.
I'm not too, since I'm doing this, I don't have to ask it. So what are some of those questions you've been asking?
Sure. Well, they're kind of common sense, and but the key is to make sure you're asking them and to keep them in your head. The first thing is just asking people if they're comfortable keeping their appointment in general. If there's a scenario where you're needing to meet with people in person, there has been one of the insurance providers that I'm serving that hasn't approved telehealth services, and that's still kind of gray area, and it's a community-based program. So it's a program where I'm expected typically to go to the family and to see them in person. So the first question I'll ask is just, do you want to still meet? We have the scheduled appointment, and for any reason at all, and you leave it really kind of open, are you feeling like you need to reschedule? And by having it open like that, it kind of allows the individual to invite in their own perspectives on why they may or may not want to meet. Sometimes people are interesting, and they will sometimes not want to talk or acknowledge directly something like the virus,
Right.
but they'll have another reason why they don't want to meet. And my like giving them an out. Okay,
Right. Right.
that's okay.
Right.
So
Right.
so that's the
But,
first.
and that sort of question is also the same for telehealth. Are you comfortable doing this?
Right.
Is there some other way that I can work with you to make sure that I can provide the services you need in a way that you're comfortable?
Yeah, it's all client centered. It's like what we're supposed to be. It's just good practice. So the first general set of questions around, do you still want to meet or not? And then what I kind of go into is I'll ask if they've been out of the state or the country for the last 14 days.
Okay.
Now, typically, the clients that I'm serving, I'll know the answer to this. Because if I'm seeing high need people weekly and somebody's a complete shut-in, even to ask a question like this would be kind of
obvious.
Yeah,
right.
And a little odd. So I may modify it and say, have you been in contact with anybody that's been out of the state? Have you had any company with anybody that's been out of the country? Is anybody popping in? And usually I'll even know who my clients, who's in my clients' lives, and I can even ask, has such and such been by, or have you seen this person, or whatever. So I try to keep the tone so that it's not alarmist, but also that I'm getting the information that I need. And then the last set of questions I ask are then specifically about the COVID virus. I'll say, are you having any symptoms, or anybody in your home having symptoms lately of coughing, of shortness of breath, of anybody with an unexplained fever or fatigue? Now that also opens up a conversation around health and checking in general. So it's kind of the posture again of just being curious, making sure our clients are okay and healthy, and that they're likely to be feeling some kind of way now if they're having any of the symptoms. And then finally, I'll ask them if they have known anybody that's been exposed to the COVID-19 virus strain or coronavirus. Of course, we know very few people in our state have been tested for that right now. It's very speculative when people maybe think they have the symptoms or whatever. But I play it cautious, and if anybody seems to answer yes to those questions, I'll just say, I'd be more comfortable talking to you over the phone right now, or maybe it makes sense for us to get on the computer. And then also just because I'm more concerned about my safety and my client's safety than I am about my pay, if something happens where it's not clear if the person is able to safely see me, and it's also not clear if I'm going to be able to pay for the session, I just go ahead and have the session with them over the computer or the phone anyway, because my priority right now is getting myself safely through this and my clients that I'm serving safely through it. So I'll figure out that payment piece later on, and I'll if I have to wrestle with a program or somebody to say, we need to be available for this person, this new format, I will. But particularly when it comes to community health, we're a little bit different, even though we're ahead of the curve and have always been with trying to find innovative ways to see our clients. That has actually pushed us into a mindset of putting ourselves out there and being accessible, and the clients that we're serving are kind of expecting that. So community psychology has been kind of turned on its ear, and we're trying to figure out how to best how to modify and still be accessible to people who often don't have computers or iPhone or whatever else.
Right. Yeah. What does that look like? I've been curious about that. Because in my office, I have a waiting room, and then my office is off of the waiting room.
Right.
And I try to envision what that looks like when a client comes in. Do I have them come in and sit down on the couch and ask them, do I have them come into my office and then ask them? In which case, it's late in the game.
Yes.
To find out. Or do I make it really awkward, stop them at the door and say, wait, don't come in. I got to ask you this before you enter my waiting room.
Yeah,
how do you do that?
Those are great questions. So the way we've done it in our practice, we have called every single client that we've had scheduled, and we've had this conversation with them beforehand. So we haven't taken anything to chance, and I've got a manageable caseload, so I'll know who's coming in and when, and my schedule's very repeating. So I've been in contact with everybody throughout. And then to add on to that, we have now in our entry door, we have wash your hands before you walk in here. So we have a glass. We're inside of a big building. We have a suite of offices in there, and when you get to our suite, before you, there's a door there. It says wash your hands before coming in. We have hand sanitizer sitting out. We aren't shaking hands of clients when we walk out. We make a point of putting our hands like this, or up like this, or something like that, just to kind of acknowledge again. And everybody almost reciprocates and realizes that right away. I've had a lot of people head nodding or something like that as a way of kind of showing regard and being friendly, but not also respecting our space. So it seems like everybody just knows they're in this bubble now, and we haven't had too many people stepping out of that. But we're talking about this past week. There's maybe 4 other partners that I have at my practice. We're all kind of in a set of rooms. We have probably a quarter, maybe less, of inpatient, like clients that are coming to the outpatient facility. At least 75% of who we're seeing right now is over the phone. So or telehealth. So
and it may be 100% soon.
Yeah, I'm expecting that. This next week, I'm expecting those numbers to continue going down. It's really difficult. A lot of the clients that I've had, we worked so hard to get them out into the community, and the idea that they're coming to therapy certainly is the only place they were going to go in an entire week, and now it's like now we have to think different about that. We have to have a conversation about why we're modifying this. And the clients, generally speaking, that I've been serving have realized that this is an exceptional time, and that even if it was their goal to be out in the community and seeing me was maybe the biggest social movement that they made that week, it has to take a break right now. And that people seem to understand their progress, therapeutic progress is important, but their livelihood and the livelihood of others is more important, and people are understanding that right now.
Right. Yeah. It's a tough balance, and it seemed like 2 schools of thought too, as far as, do I let my client make the decision, or do I make the decision for my clients?
Right.
Some people who say, we're just going to let them decide, whatever they want to do. I've gone the other direction and just made the decision for them.
Right.
Said, look, and there's pros and cons to both, but I think you just have to go down one of those paths. And as clinicians, it's hard to decide, what is the better pro and what's the worst con for this situation.
Yeah, and a feeling we're at a point now where we're really close to where that decision won't be made by either one of us. And increasingly, there's an external entity that's calling that shot, which in some ways just kind of makes it easier for everybody. And yet, for the time being, there's still this kind of gray area. And I think we're all of us are kind of consulting a lot with colleagues. We're checking up on the news regularly. We want to see if things change even throughout the course of the day. And you have some things scheduled, you may have to change those things immediately. And in general, the other thing to be mindful is that we're always keeping a lot of space around us. There's this idea of no matter where we're going or who I'm interacting with, I've been like in this bubble now, and I'm very cognizant of that. And that doesn't only just mean clients and people that I'm seeing, but there's other people in the building that I'm working out of. There's people that I'm going to be running into in the parking lot, so it's just like everywhere I go now, I'm more mindful. Every doorknob I touch, everything that I interact with, I'm just much more mindful of. And I'm going to continue serving my role until it just seems like I have to find a new way of being entirely. And community psychology in particular is really learning how to modify and be a little less accessible than it has in the past. We're really scaling it back.
Yeah. It's going to be really interesting what this looks like on the other end.
Yes.
any kind of long-term changes that we will be doing.
Yeah, I'm a little optimistic about that, actually. I think what we're going to have is a template now where people see that telehealth is a viable thing and that it's something that that works. So I feel like this is actually going to, in the end, in funny kind of ways, to make it so that we are more accessible and that we don't necessarily have to think in the same old way that we used to think of us going to the client or the client coming to us. There's this whole new thing right now, and we're forced to do it. Now that we've all experienced it, we're going to have been used to it. So it might even happen in the future that the weather's bad, so we decide to have a telesession. And it's just better for everybody. And that I think
absolutely, yeah. The number of cancellations and no-shows we have being in Wisconsin due to really bad snow, and some clients will still they'll risk it and go out there, and it drives me when they do that because I feel so bad that they're doing that. But when you need help, you need help, and now this offers it, and that's a really good point you have. This opens things up and it makes it less scary for them. So no, I'm not going to go out in 6 inches of snow and risk, getting in an accident. So that's a really good point.
Right. Hopefully, there's some good that will come out of all of this, and I think we'll all end up looking back at the experience once we're through with it with no shortage of learning points.
Absolutely.
Mike,
so thank you for doing this video and helping out with out.
Thanks. I was going to thank you as well. Thanks for spending some time again together today, and hopefully with our continue to work together in somewhat modified form, we can continue getting some perspectives out into the general community and to other mental health professionals.
Absolutely.
Take care.